I've got a client had a double lung transplant on a Medicare Advantage plan. 0 issues. Raved about the plan. Literally, he paid hit the max out of pocket. I think it was like $4,000 in the plan. Double lung transplant, 0 issues. Insurance company, I mean, it was unbelievable. I think it was 7 figures of cost. No issues. Loved it. Literally, and I talk about the plans being dynamic, changing from year to year, a couple years down the road, because again, we work with our clients ongoing. It was a better option. It was just more competitive. Right. Same company, by the way. He didn't want to change from that plan. He felt so good. He's like, I saw what they did. I don't even want to change. Now, granted, he did end up changing. He saw, hey, it's very simple, black and white. Like, this is going to be more competitive for you. It was actually more work for us to go to him and say, hey, this is just better. But that's what we do for the clientele. But, a little bit lower cost share when he goes and uses it. Right. And again, these plans are dynamic, so we got to stay up with them. But that's the other side of the coin that people don't get to hear.
Yeah, it sounds like, in a way, when you'd initially described that, Medicare itself, fraud, waste, and abuse, we hear about this all the time. I mean, there's articles about it all the time. Providers being taken down for, writing prescriptions for thousands and thousands of back braces. That's a very common one, durable medical equipment. So, Yep. I mean, it almost sounds like Medicare itself, federal program, recognized their shortcomings and were like, hey, we don't have a system in place to take care of this. So they went externally to these private companies that, let's be honest, they specialize in managed care. They provide it in the commercial space. They provide it in the ACA marketplace. And they went to them and said, hey, you do this for a living. Let's bring you in and you meet all this criteria. Here, you do this.
Right.
We'll pay you for every person that enrolls. Right? It's almost like hiring somebody to do your landscaping. Right?
Well,
you could do it yourself, right? You could do it yourself. The problem is it takes a lot of time.
You got to go buy a lawnmower.
It's expensive.
Yeah.
And you probably do a terrible job and you get very frustrated with it. Now you have to do it again. There's more time wasted, right? So they went and they said, hey, I'm going to bring somebody in that does this for a living, and they're going to do a really good job as long as they meet this criteria, right? Same principle. So going into the prior authorization pieces was all right. Going into the prior authorization piece as well.
Well, let me just caveat that. Hold that and shelf that for just a second, because I know that you want to go on that story, and it's really important. But I find that, again, to be so important to understand that at the same time as with what we're talking about now, there's people involved in every layer of everything. People are the problem, and people are the solution. And there's good people and there's bad people. People that make good decisions and people that make bad decisions. Sometimes good people make bad decisions. There's all kinds of caveat there. And we're not saying that insurance companies that are administering some Medicare Advantage plans have done some things that for sure maybe they shouldn't have done. Right? But there's also, you got to understand the whole picture. And this is where we talk about it. Again, people need to understand all their options at 65 based on the true picture of where we're at, not hearsay. Same thing when it comes to Medicare Advantage. Is it evil? Is it the best thing on the planet? No. So, somewhere in between. And is it right for you? It might not be.
Right.
Is it right for somebody else? It might be. Right? Is a Medicare supplement plan right for you? It might be. Many people we talk to, it is.
Right.
And we help them with that. Contrary, it might not be. So to recognize that, insurance companies sometimes do things wrong, but we need to understand what they're doing right, what they're tasked with doing, what problems they're actually solving, and in how many actual good stories there are of people out there that love coverage and love the plan that they have.
Yep.
But I'd love to hear about that billing.
Yeah, the prior authorization piece, I mean, it's huge. You've already, hit the nail on the head. It's the responsibility of the provider. I feel like a lot of beneficiaries don't understand that. They feel that it's going to be their responsibility, the individual, the beneficiary on the plan, or it's Medicare's responsibility, or it's the insurance company's responsibility. No, actually the provider, their doctor's responsibility to justify the necessity of the service being done.
Right.
They can't just go and say, oh, you need to have an MRI because, you broke your arm. Right? Well, that can be identified on an x-ray. So they're going to say that doesn't make sense, right? Let's do this. This will make sense. So do an x-ray first. And then if there's more things we need to look at, right? Soft tissue damage, then we do the MRI at that point. Right? They're going to pay more in the long run if you think about it, right? They have to do additional testing, but they're starting off with the stuff that actually makes sense. Okay. So I had a couple of couple of ladies that came to us, and they both work in the billing space. They actually work on the side of the business that submits the prior authorizations from the doctor's office to the insurance company. Right? So they review the prior authorization before it goes out. And they both, at first, were like, I don't want anything to do with Medicare Advantage. Right? And it came back to was prior authorizations. But when we actually broke it down, like, they're in the space. We broke it down how it works, and they're like, you know what? You're right. It is the provider's responsibility. They turn around and go, we could give you the list of every doctor in this county that can do a prior authorization every single time, no problem, get it approved, no issue at all. But we can also, conversely to that, give you the list of doctors' offices in this county that can't even get a date of birth right. And they're like, every single time it comes back denied. Why? The insurance company looks at it and goes, this isn't the person that we insure. Who is this? Exactly. So, of course, they're going to deny it. But then what happens? The provider goes and they point the finger at the insurance company saying, they're evil. They didn't approve your service. Well, you didn't even file the claim correctly. So let's just be honest, right? There are cases where, like you said, the insurance company, they don't do things correctly. That's true. But there's also cases on the other side of the doctors not doing things correctly. It happens. It does happen. And so that's extremely powerful. And just to add on to the lung transplant story you had, I had a client as well, double lung transplant on an Advantage plan. Got put on Medicare early because of it, but only had original Medicare at the time. His doctor literally goes, you're going to have a lung transplant. You need something. And the only thing you can do right now, because you're under 65, is an Advantage plan. So he opted into one. And he had the surgery. He was in the hospital for, I believe it was like 4 or 5 months total.
Wow.
Right? After everything was said and done, it was about 4 and 5 months total, which Medicare, right? We know that Medicare only covers 150 days. That's it. After that, you don't have coverage. Original Medicare, that's a federal program. His Advantage plan covered him beyond the 150 days. And he got the bill afterwards, showed me. He's like, this is what I had to deal with. They charged the insurance company, I believe it was $5 million for all the services he received while he was in the hospital. And his out-of-pocket was the inpatient hospital stay. That's it. He didn't even meet the max out-of-pocket.
Wow.
He paid $1,700, showed me the bill, paid $1,750 for that stay. That was it.